So we'd like to now delve into the other side of this issue, looking at the effects of addiction and what measures have been set up within the community to assist those in finding help. Our next guest speaker is the president of Families Against Narcotics, FAN. She's been appointed by Governor Snyder to Prescription Drug and Opioid Task Force and the Regulation Enforcement and Policy Subcommittee, and is one of the founders of Operation RX Macomb County. And I'm going to deviate from the script for just 1 minute. Judge Linda Davis was part of the series that we did at WJR on opioid addiction and heroin addiction. So I got to spend time inside Judge Davis's drug court. And this kind of hit home this morning when I heard the Lieutenant Governor talking about this warm handout to people, extending that warm handout. A couple of your other guest speakers talked about that person-to-person connection in dealing with this problem. So I go off to the judge's drug court, and I watched as people came up to her to talk to her about how they were going on their journey to recovery and self-sufficiency and back into the community. And I'll never forget it, one of the first young ladies who came up to, court's a scary place, we can all agree. So one of the first young ladies to come up in front of the bench, in front of Judge Davis, and the first thing that Judge Davis said to her was, "You've got a new haircut." And I was so impressed with that. In fact, it made it into the series, the audio did, because it signified that she obviously knew this person, cared enough about this person to ask about a haircut. And I saw her doing this with one person after another. And she had to be tough with some of those people. Some of those people ended up in jail. But she talked them through the process. And I was just so impressed with her drug court. So it's such a pleasure to introduce all of you to Judge Linda Davis.
I'm not a podium person either, so I'm going to stay up here just because I'm afraid I'll fall if I try to get off the stage. So it's a real honor to be here today, and as I got here early and was walking around the room, I've met so many of you that I've seen before on my journey on trying to make a difference to this, but I also see many faces that I've never met before. So I'm going to spend the first 2 minutes talking about why did a judge get so involved in this to begin with. About 10 years ago, I was raising a family. I had a 17-year-old daughter who was an amazing young woman. She was a straight-A student, had been accepted at every college she applied to. She had huge dreams and huge aspirations. She was an athlete, did traveling cheerleading, and traveled all over the country competing, won many national championships. And we were close. I still was a mom, but we were close. We shared everything, and I thought I knew everything about this young lady. At the same time that this was going on, I was the prosecutor in Macomb County, and I ran the drug unit. So I dealt with drugs on a daily basis, and to be honest with you, I thought I knew everything there was to know about drugs. I mean, I locked up more people than you can imagine for drug use, drug dealing, and everything else, and I'm not proud of that. So I'll just say that and then move on because that's not part of the story. But I woke up at 4:30 in the morning one morning and I heard my young daughter in her bedroom crying. And that was not typical. She was a happy kid. And I went in and asked her what was wrong, and she had started dating a young man that I was not real thrilled about. We had many battles over that for about the month and a half prior to this. And she told me I was going to hate her when she told me what was going on. We talked for an hour. I convinced her that that was not true, that I was there to help, that no matter what it was, we'd get through it, and I thought I was going to be raising a baby. That's what I thought was happening here. Unfortunately, that would have been an easy thing to do. The hard part was within the next hour as this unfolded. She told me that she was addicted to heroin. And my world collapsed. I'm going to tell you the next 3 years, and this was 10 years ago, and I still get shaky when I talk about it, because this is a disease that affects the entire family. I was on the board of one of our local hospitals, and I took her there because I called every facility known to mankind trying to find help, could not find any, and showed up at the hospital where I was on the board. And they did, after much cajoling, pleading, and threatening, decided that they would take her in and detox her. And I had no idea what I was in store for. The next 48 hours were horrendous to watch as a parent. I had no idea, and I thought, well, we'll detox, we'll move on. We love each other, we're going to get through this, everything's going to be fine. But in that moment at that hospital changed my life forever, because once I got my wits together, I went out into the hallway to call my secretary to tell her that I was going to be absent for a few days, that I was dealing with a health crisis in my family, and I was crying, and I'm not a crier. I don't cry over anything hardly, but I was crying. And I heard a doctor and a nurse talking about the poor, pathetic mother standing in the hallway crying over her junkie daughter. And I knew that at that moment, that if we ever got through this battle together, that I was not going to sit quiet and let other people be treated the way that made me feel. I felt like total garbage and trash. And I'm not, but it made me feel that way. And I thought, wow, those words were so powerful. And I looked at my daughter and thought, am I missing something here? So I started on this journey to try to change the system. And I'm going to tell you that I've been working diligently at this for 10 years now, and that saddens me to a lot of extent, because for the first 5 years, I felt like I was bashing my head against the wall. You know, I'd feel like we made one step forward and then wham, we'd hit a wall and nobody was listening again. And I think of the hundreds of kids in my own community that died during that 5 years that nobody was listening and paying attention. So I'm going to lead with this, but I just want to really compliment the doctors that are here today. I'm so glad that I got here early enough, because one of the things that we've been doing through Families Against Narcotics is educating doctors, getting real stories behind real faces of how this got started. My daughter's addiction, I believe, started from a knee surgery. And her personality changed from that point on. It was subtle, but she was much more susceptible to using after that. So this journey started as we were just going to go into schools and talk to kids about, you know, this is terrible, and we were taking young addicts in to talk about what the struggle was. And I'm not going to belabor this. It started small. We were just a mom and pop group led by a judge, which opened up a lot of doors. But we now have 14 chapters in the state of Michigan and 7 more that are going to be starting within the next 2 months. So we have just grown exponentially. And we've started a lot of programming as a result of that. And a lot of my buddies in this are sitting in the audience. Fan had an idea of making this a community project. And we weren't at first. We were just a group that was educating in schools. So we put together a forum where we called it Operation RX, and we brought every community leader together that is touched by addiction, whether it's EMS, doctors, senior citizens, dental community, nurses, recovering addicts, families of recovering addicts, CARE of Southeast Michigan, Macomb, who is our access center, our health department. And we did a roundtable, and we brought in somebody from out of state who was distributing Narcan massively in the state, and we needed some place to start. So we brought them in, and it has turned into an incredible group that has accomplished so much. And I say that because we need to work as a community if we're ever going to change this. The one thing I stand back and I look at is how much inner fighting there is between us. Everybody wants to take ownership of everything. We're not willing to share information, and so we're redundant. We keep doing the same things in different pods all over the state. We need to start working together, not to tell you to quit doing what you're doing, but to share it with everybody, so that if you're doing this really good and I can do something different with my resources, then let's do that where we have a comprehensive approach to how we're dealing with addiction. After Operation RX started, literally within 3 months, every first responder in our community had Narcan. But every time we resolve one problem, I find another one. We got Narcan in the cars, but then what was happening is they're taken to hospitals. They spend the next 3 or 4 or 5, 6 hours there, and then they're released back out into society. And sometimes Narcan is used on the same individual 3 different times. So now we're trying to bridge the gap between that. I want to talk a little bit about one of the initiatives. I am a drug court judge, and that is my favorite part of my job. If I could do that full-time, 8 hours a day, every day of the week, it would make me really happy. But unfortunately, I don't have the money or the resources to do that, and I still have to do my full docket. But we work with a lot of young recovering addicts, and my passion is helping young recovering opiate addicts, which is a real hard thing to do. But I've worked really hard to create initiatives like a jail program where we use Vivitrol upon exit. You keep relapsing. We start with the lowest level of treatment, which is no Medicaid-assisted treatment. Then I move to Vivitrol. If that doesn't work, you go to Suboxone. If that doesn't work, then you go to methadone, not the reverse. That's the same problem we made with prescribing opiates, is you don't start at the top and try to work back. It's too hard to do that. You start at the bottom and you move up. I'm proud to say that I've never had to get to Suboxone or methadone, and I have a 100% success rate with young people that I've used Vivitrol with to help them move through the system. But that's not a magic bullet, and it's important that we always add that as a part of this talk. Vivitrol is one tool in the toolbox. It has to be coupled with support group meetings, with a community support, which is what FAN provides. We bring families in and we start educating the family about addiction so that mothers and fathers and aunts and uncles are not enabling and taking them back a step when we're making progress with moving the addict forward. We need to make sure that we have medically assisted treatment available. Peer coaching has been huge in my drug court. It took us from here to here when we added peer coaching for these young people. Counseling, we need to find out what got them there to begin with and help them unravel the self-loathing that they have. Because I'm going to tell you, my daughter has been clean 8 years in June from opiate addiction. And people will say to me, well, she must not have been that bad. She was 86 pounds, soaking wet, and I literally was watching her die on a daily basis and could not reach this kid. And I did everything. I pulled out all stops. I used every dime I had in savings to get her to where she's at. And I oftentimes look back and think, if I wasn't a judge and I didn't have the resources that I had available to me, how long ago would I have buried this child? So we need to really work hard on both sides of the table, making sure that we have bipartisan legislation that is going to treat every individual that is affected by addiction, regardless of economic status, race, gender, national origin. And we need to start working on decriminalizing addiction and looking at it as a disease. It is amazing to me how many people that work in the addiction field that don't seem to think of this as a disease. We treat it so differently than we do another disease. We don't self-loathe people that have cancer or diabetes, but yet oftentimes medical personnel, nursing staff treat addicts like they are self-loathing. This is not a moral deficiency, it is a disease, and we need to demand that our kids are treated with respect when they are suffering from a disease. And I'm really pleased with what these doctors are doing, because I think that's part of the solution, and really getting doctors to understand who these people are. So the other program that we just started this year, and it shows you what can happen when a community comes together, is about 2 years ago, we were reading, I read every article that's on Facebook, or I Google terms all the time, and I read every article that comes up, and we saw a program out in Massachusetts called the PARI program, where police were inviting addicts into their police department and helping them with finding recovery. And I thought, wow, that's a unique thing. Boy, if police can change their minds about this, anybody should be able to change their mind about addiction. So I started working with our police department, and being an ex-prosecutor, all of those chiefs are now my age, so I know them all personally. And I started holding luncheons, because you have to feed police if you want them to do anything. If you're a policeman, that was just joking. Okay, but I started inviting them to my office and having meetings about, hey, how about doing it as a whole county? Let's not just do one police department, let's do the whole county. And I'm going to tell you, it wasn't a pretty picture in the beginning. Not one police department was willing to sign on to do this. It's like, we don't have the manpower, we can't do that, we can't do this. And I'm not about taking no for an answer. You give me a problem and it's not, I'm not gonna look at how is it gonna stop me. I'm gonna look at how can I jump over this hurdle and make this happen. So we put a team together with Southeast Michigan, our health department, Macomb, our EMS providers, and we started working on a protocol of how can we make this work. Our police departments took massive cuts over the last several years, and they don't have the manpower to start calling treatment facilities. So what we did, FAM provided 250 angels that would do the calling. We got EMS to agree to transport for free if we could find a treatment facility. We partnered with over 300 treatment providers. We looked for treatment providers that did all three kinds of medically assisted treatment so that nobody was locked in to the most severe treatment before they got the lower treatments. We added peer coaching through Care of Southeast Michigan is training peer coaches for us, where we could try to connect every person that comes through the program with a peer coach to help navigate the system. Once they're let out of the hospital, they're detoxed and they're moving forward. Now, have we had roadblocks? You bet we have. Detox beds are hard to find, but I'm proud to say that we have placed 179 people as of this morning in a 9-week period of time, and those people were placed in, most of them, in under 2 hours. Under 2 hours. So what everyone said could not happen, what everyone said could not happen, happened. But it didn't happen because of me. It happened because of Operation RX and the community partners that we made through working together as a community. So we need to get over ourselves. We need to realize that not one entity is going to solve this problem. We need to work together to make sure that we are providing the most comprehensive look at addiction that we can do, that we are providing the most comprehensive treatment for what we can do, and that there is a continuum of care not only for the addict, but for the families of the addict. I look around this room and I know that there are several families here that have lost someone to this battle. And I applaud you for being here today, because you could look at this as my fight is over. And for many of the families that we work with that have lost a child to addiction, their fight is just beginning. They're with me, they are soldiers and making a difference in how our community looks at addiction, changing the face of addiction, and speaking out about what the flaws were in the system that need to be worked on and fixed. We tell addicts all the time, if you keep doing the same thing over and over again, you're going to keep getting the same results. But that's exactly what all of us have done for the last 10 years. We know treatment, the way we've done it in the past, doesn't work, but we keep doing it over and over again. I mean, I'm not a doctor, but I know that when someone has to go to 7 to 15 treatment facilities, if they're lucky they get well, that maybe that system's not working. And we need to think outside of the box, expand our thoughts, expand our vision, and be open to some new ideas. Peer coaching is the simplest thing that you can do, and it's amazing what it does when you connect another addict with someone who has been getting it right, knows the ropes, and knows how to hold your hand and walk you through addiction. Now, I'm a compassionate person, but I can also go at you big time if you want to fight. But I've always taken the approach. I knew when I got involved in this that we did not need to make enemies. We need to make partners. And so if you're feuding amongst yourself in your community with different groups, you need to fix it. You need to fix it because kids are dying and they're depending on us to get this right. So I hope that you'll join us in this fight, that you'll start getting over ourselves, that we'll start working together, not only as Macomb County, but I know we're meeting with Wayne County to hopefully take Hope Not Handcuffs into that community. This isn't about any one community. It's about our community. Let's fix it. Thank you.